Thank you, Governor. Good morning, everyone. Thank you for joining us. I want to echo several of the Governor's sentiments. First, to all of the businesses out there, Rhode Island Department of Health, Commerce, so many across state government have been working hard to be able to prepare for you the specific detailed guidance that you'll see coming up over the next 24 to 48 hours so that you know what you'll need to do. We want to be here to support you as the economy reopens. I also want to relay a huge thank you to teachers throughout the state, as well as to the foster families that the governor spoke of. I often talk about health equity, we all do, and about how we need to get at community level factors, because those factors are what have the greatest impact on health outcomes. We talk a lot about health care, but when we say health, we're not just talking about what's going on in the doctor's office. Health starts in our communities. It starts with the foster families that we are expressing appreciation for. It starts with the kind of food we have access to. It starts with the employment opportunities we have access to, and it starts with our schools. Teachers and other school personnel have an enormous role to play in building healthy communities. We need to keep thanking them, supporting them, and partnering with them to ensure that all children bounce forward from COVID-19 academically and keep growing, learning, and progressing. In terms of our COVID-19 data, our number of new positive cases are on the low side today. We have 73 new positive cases to report, and we had 79 new positive cases that would have been reported yesterday. These numbers are on the lower side because of the holiday. With the Twin River site being closed and other sites being slower, we expected a drop in these numbers. Our numbers of people who are currently hospitalized has remained steady. We have 226 people currently hospitalized at this point. We had 224 people currently hospitalized for yesterday. Of the people who are currently hospitalized, the 226, 50 are in the intensive care unit, and 36 of those 50 are on a ventilator. These numbers for people in the ICU and on ventilators are both roughly half of where they were a few weeks ago. This is definitely an important sign for us to continue to monitor. However, it is very important that we do not get complacent. What we are in is a marathon, not a sprint. COVID-19 is going to be part of our lives for some time. So as we go forward, we want to make sure we continue to adopt the social norm changes that we know are critical to helping us crush COVID. Generally, Rhode Islanders have done a very good job following the governor's guidance and following the public health guidance that we have been sharing, but the landscape statewide can change very quickly. We've known to have additional focus on our communities that are disproportionately impacted to make sure that they have the resources needed. And it is going to be so important for us to embrace the new set of social norms to prevent the spread of viruses throughout the state. As we have been saying, this means continuing to keep our groups consistent and small, continue to wear our masks when out in public, continue to wash our hands thoroughly and frequently, and most importantly, staying home if you're sick. We continue to repeat these measures because these prevention measures work. They are critical at every phase of this pandemic, especially now. In terms of the fatalities, we have 13 new COVID-19 associated fatalities to report today, unfortunately. One person was in their 60s, 4 people were in their 70s, 3 people were in their 80s, and 5 people were in their 90s. Although we did not post a data update online yesterday, we also had 13 new COVID-19 associated fatalities confirmed yesterday. That means that our cumulative total increased by 26 since our last data update. Our thoughts and prayers are with the families and loved ones of these Rhode Islanders we have lost. I'm going to finish with echoing the governor's point about wearing masks. It is a truly effective way to help prevent the spread of viruses. Continue to think about the fact that you wearing a mask means that you're telling the Rhode Islanders around you that you care, that you want to help protect them from getting exposed. Two final things that are key is, even though you are wearing a mask, it is important to continue to not to go out into public if you are sick. It is critical to continue to stay home. The second thing that's key is the mask, as we've learned more about this virus, is effective at helping someone that does not have symptoms but may have COVID-19, even if they're not aware. It helps prevent them from spreading it to the next person. So please continue to engage with us in doing that, helping to make the difference that we know is critical.